I'm Georg van Hoosen, therapeutic area head for cardiometabolism at Boehringer Ingelheim. We started in 2011 and both companies had complementary skills and complementary pipelines, and so we thought that both companies can achieve together more than each company could achieve alone. And we now look back 7 years into the alliance. The BI-Lilly alliance is number 4 in the oral anti-diabetes market, which is a market segment that neither company has been present before. So I think that speaks to itself and the success of the alliance. We want patients with type 2 diabetes to live a longer and healthier life. Because today, despite advances in healthcare, patients with diabetes still die younger than the ones without. So we want that they can enjoy a longer life and spend time with their loved ones. There are 2 main reasons why patients with diabetes die younger. The first one is cardiovascular disease. That includes coronary artery disease, myocardial infarction, stroke, but also heart failure. Patients with diabetes have a 2 to 5-fold higher risk of developing heart failure, which is a debilitating disease with a poor prognosis. The other main reason is kidney disease. Diabetes is the leading cause for end-stage renal disease requiring dialysis. And patients with chronic kidney disease also have a significantly higher risk to die of cardiovascular events.
Diabetes and cardiovascular diseases are closely linked to each other. What we know is that one of the consequences of diabetes is cardiovascular diseases, and most of our diabetic patients die from cardiovascular consequences. So that's one of the reasons why we approach diabetes and diabetic patients from more than one angle, and we don't focus any longer on glucose lowering medications, but also deal with the grim consequences of this indication.
It is very much important to conduct cardiovascular outcome studies in diabetes. You see, diabetes is a very complex disease. It affects not only glucose metabolism, but lipids, arterial hypertension, the nerve system, and many other things that eventually end up with a common threat, which is cardiovascular death.
Around 50% of deaths in patients with diabetes are due to cardiovascular disease. So it's important that we go beyond HbA1c targets and look at, is the medicine safe from a cardiovascular point of view? And also ask the question, can we reduce cardiovascular mortality with the right molecule?
So what can be done to help patients to live longer and prevent cardiovascular death? There are new treatments that recently have shown that they can address cardiovascular death and kidney disease independent of glucose control. This paradigm shift is already reflected in guidelines and now needs to be translated into clinical practice. We have an exciting time ahead of us with the Boehringer Ingelheim and Lilly alliance. We have ongoing programs running in heart failure and chronic kidney disease, and those programs also include patients without diabetes. That means we want to develop the standard treatment for cardiorenal protection and by that accomplish our mission to help patients live a longer and healthier life. We believe in success through partnerships and the value creation through collaborations. We do that with our global alliance with Eli Lilly for clinical development and commercialization, but we also have partnerships with research experts, associations and research institutions because we believe that together we can achieve more for patients with type 2 diabetes and patients with cardiovascular and kidney disease.